Some of the things that we can do for the adductors is an adductor self-myofascial release. So what you want to do is you're going to position one of your knees up like this, and then you're going to roll left to right, keeping the foam roller on the upper inner part of your thigh. Outside of the self-myofascial release that you can do on your adductors, you can do an adductor stretch. So what Kim's going to do here is she's going to kick out one of her legs out to the side and try to get as far as she can, keeping her chest facing the ground. And then she can start on her hands and then slowly start bringing her body down towards the elbows to try to get more of a stretch on the adductors. Now, this can be a temporary fix, but if she does this over a long period of time, it can also be more of a permanent fix. One of the strengthening exercises that Kim can do for her glute med is a lateral tube walk. So what she's going to do is take a resistance band of appropriate tension and place it above her knees on her thighs here. And she's going to walk to one side for a few steps, trying to drive that big toe on the inside and actively driving the knee to the outside and walking with slow, controlled tension. So small squat position, walking over this way. That's going to really work that glute med and help strengthen that underactive muscle. A second exercise that Kim can do is one that's going to activate the most glute med, which is a lateral plank. So it's not a movement, but it's more of a static hold. So we're going to take that band off, and we're going to go into a lateral plank here. And there's different ways that we can progress or regress this exercise. So if we want to make it the hardest way possible, she's going to go lateral plank on her elbow, and she's going to stack both feet up. So right here, by driving that hip away from the ground, she's working a lot of glute med, and this is the most difficult version. If this is too difficult, she could stagger her feet and put one foot in front, keep the other foot back, and then the other thing that we could do is drop this bottom knee to be able to have a modified plank